Hey, Dr. Dave Marquis here, and I wanted to finish the series of stretches and exercises that you can do for the lower extremity. This one is for our calves, and previously I was talking about how to release some of the muscles on the front side of the leg, the peroneals and tibialis. This is a great stretch that you can do for the gastrocnemius and soleus. So these are muscles that when they get shortened, they can contribute to foot and ankle pain, and they can also contribute to how well our knees move because they attach right on the back side there. I like to do this in a standing position, so you can do it off of a curb, you can do it in a stairwell. You basically just need something that you can put your hand on so that you can keep your spine straight through the movement. So what I'm going to do is I'm going to stand on the balls of my feet with my toes firmly on the step right here on the curb, and my heels are hanging off. And now I'm just going to drop those heels down so that I get a good stretch through the gastrosoleus muscles there. And I'm feeling a straight midline. And now what I like to do is I like to shift my weight. So now I'm shifting my weight so that some of my body weight is on the outside of my baby toe on the left and on the ball of the foot on the right, my big toe. And then I'm going to shift back to the other side. I'm describing this because I know you can't really see the actual movement. It's kind of subtle, but I'm shifting over to the other side now. So now I'm basically have most of the weight on the ball of my left foot and the baby toe on my right foot. And I can feel how the fibers along the back of my gastroc and soleus are actually getting stretched individually, going back and forth. As I do that, it's actually allowing me to go down a little bit further. Now the key to this one is to not shorten it when you stand up. So I'm not talking about doing calf raises. Don't do that. For the purposes of this, you just want to elongate it. So you're just going to keep that down, and after you've stretched that for about 30 seconds, step off, and you're going to be in a neutral position. You can go back and do that a couple of times, but one of the things that's really important about this that I want to impress upon people, we live in an area where there's some sand dunes, and on multiple occasions over my past 25 years, I've had patients come in where they've had a tendon rupture, where their Achilles tendon is actually ruptured because they engage in some of these activities when the muscle and the tendon are not prepared. Now, for somebody to get to the point where they're actually able to rupture a tendon, there's other mechanisms at play there. They're probably dehydrated, they probably haven't been keeping up on their magnesium and potassium appropriately. Hydration is really huge in that sense. But the pliability of our muscles really comes down to how frequently and efficiently we're using them before we engage in an activity like that. And in each of the cases that I've seen in people when they have tendon rupture, they typically have one or more of those risk categories where they're dehydrated, potentially minerally deficient, or they engaged in that activity without doing preparatory stretches to allow for that tissue to become more pliable. So keep that in mind. This is a great adjunct to some of the other stretches that I showed you how to use on the front of the leg. It's wonderful to keep our lower leg muscles pliable because your feet are going to be happy for it. Have a great day.